Links, a year in review, 2011-2012. Hello, welcome to this special magazine created especially for our friends and supporters of Links, and of course all of you who want to discover more about what we do and who we help as an organisation. Using our combined resources at Bournemouth, Poole and Dorset Links, each year we ensure that our overriding aim is to improve health and social care services by listening to people just like you. What's great is that we are independent of local councils and the NHS, and our job is specifically to listen to the public and pass on what we find to the NHS and social services departments. In this magazine, you will hear some wonderfully inspiring stories about people wanting to make a change, but not knowing where or how to get started. The Links have helped in some cases monetarily, and in others by providing care and support for each of these projects. There has been some incredible input from young people who are clearly keen to get involved in their communities, and some really tangible outcomes from projects we've worked on. For example, the great inroads that have been made in making it easier for the Chinese community to connect to healthcare services, and the heart-rending but ultimately inspiring story about impact of changes to social care in Poole. In addition to these inspiring stories, we've included some facts and figures about our organisation at the end of this recording. Our volunteers and supporters are simply amazing. The work that they do is so crucial to our organisation, and we feel blessed to have their help and support. We always welcome new supporters who want to volunteer, get involved. Keep in touch with us via Twitter and Facebook. Details at the end of the recording. We'd love to hear your thoughts. Later you will hear how our organisation is really changing for the better, and from 2013 we will proudly be known as Health Watch. We hope you enjoy listening to this recording as much as we have enjoyed putting it together for you. Very warmest regards from Bournemouth, Poole and Dorset Links. Have a Say Fund. This year, Links across Bournemouth, Poole and Dorset have provided £20,000 worth of grants to local community and voluntary groups as part of the Have a Say Fund. Groups were encouraged to apply for the funding, with the remit being that their project had to relate to health and social care and contributed to the aims of the Links. Groups also had to undertake to actively encourage their membership and networks to join the Links and to feed back to us their experiences and views on their local services. We encouraged groups that don't normally apply for funding for whatever reason, be it legislation, the extensive work that goes into grant application, and the time that it often takes to apply, for instance. So we made it as easy as possible for groups to gain the funding we could provide. We were delighted to allocate grants to 40 groups. Here are just some of the groups that benefited this year. Active Games for All. A small group of grandparents wanting to improve outside leisure facilities in Verwood. Fundraising for a multi-use games area suitable for all ages. Wessex Autistic Society. They help people with autism access services and develop social and communication skills to become more independent. Verwood Breast Friends. Support for breastfeeding mums. Bridport Disabled Friends and Carers Club, who provide company and advice for disabled people and carers. Moving On. A social club and support group for people who have suffered from or are in the process of recovering from mental illness. Money used to promote use of allotment and gardening. Dorset Mental Health Carers. They support people with mental health issues and their families. Money used for drop-in sessions and activities. Pool Links grant of £300 to Parkstone Sports and Arts Centre was used to update some of their sports equipment. The Recreation Road Centre in Poole delivers affordable arts, drama and sports training sessions to local underprivileged children and young people. They have over 500 active members, are open 3 evenings a week, and encourage the local community to use their facilities. To celebrate the evolution of Links into Healthwatch in 2013, we're increasing the amount of funding available through our Have a Say fund this year. Last year across Bournemouth, Poole and Dorset we had £20,000 available to provide for grants. This year it has increased to £35,000. So please contact us now to ensure your application is processed. It's simple to apply. Just give us a call today on 0300 111 0102 and we'll send you the application pack. We're changing. Links transition to Healthwatch. In 2013, the Links, that's local involvement networks, will be known as local Healthwatch organisations. Under the Health and Social Care Bill that was recently put through Parliament under the NHS reforms, it was decided that the Links projects across the UK will be succeeded by new local Healthwatch organisations with a new set of priorities. The new local Healthwatch organisations will 1. Help shape the planning and delivery of local health and social care services. This will be a continuation of the Links' current work. 2. Provide improved signposting and information help to people to make choices about health and care services. 3. Provide an advocacy service for people making a complaint using the NHS complaints process. This means that our local Healthwatch here in Dorset will be more involved in strategic decision making via local councils' health and well-being boards, providing more support for individuals and community groups and becoming more of a voice, a consumer champion, locally and nationally. At a national level, Healthwatch England will provide leadership, support, health and advice for local Healthwatch organisations, creating more of a consistent approach across the UK. They will also be able to advise the Secretary of State for Health, the NHS Commissioning Board, and feed back to the Care Quality Commission about concerns raised by local Healthwatch organisations. There is a lot of work that needs to be done to ensure this transition is completed successfully, all of which is in the planning and implementation stage at the moment. We will ensure that all information and updates are provided via our website and social media applications. What's the benefit? Poole Link steps in. Poole Borough Council commissioned us to carry out a research project into the impact of cuts to social care services in Poole, resulting in a report entitled Just Another Day Spent on My Own. This groundbreaking project involved interviewing people who had experiences of loss of some services. Following the report and recommendations by Links, Poole Borough Council decided to allocate a major financial kickstart of £100,000 to support people who had been affected by the cuts. A further £50,000 a year is also being provided on a recurring basis for people who are assessed and not deemed eligible for social care services yet still require support. That support will be delivered by local community groups and organisations. David Vitti, head of Adult Social Care Commissioning at the Borough of Poole, said, "Links was very anxious that we do return to people and make sure they are safe and have found alternative provision, and that's exactly what we are doing now." Councillor Peter Adams, Cabinet Portfolio Holder for Adult Social Care, Borough of Poole, said, "This important report will help us understand how people have been affected by changes to adult social care services in Poole." Pleasingly, there was significant media interest in this report, and even a feature produced for BBC Radio Solent. What has resulted from this project is that a nationwide impact has been achieved, with other councils around the country realising they too need to get involved. Not only has there been a major financially tangible outcome to this project, but also, following our Links report, the Council in 2012 is producing a full daycare review which will help them assess the resources available to those in need. A joint exercise between the Council, NHS and service user and carer organisations will agree the key gaps in service and priorities for the new investment. The link worked closely with Poole Forum, PRO Disability, Rethink and independent researchers on this vital project. Residents in Hamworthy have even more to smile about. Hamworthy residents will soon benefit from a new NHS dental service thanks to a campaign led by Poole Link. Smile Care Dental Limited has been awarded a contract for 7,000 dental appointments in Hamworthy, which equates to one full-time dentist. They are now securing premises in the area and plan to be open for business within the next 3 months. Poole Link carried out a survey in 2009 to find out how Hamworthy residents felt about their access to dental care. The survey results revealed a real need for a local dentist, with over 90% of people saying they would go to an NHS dentist in Hamworthy if one was available. Louise Bates, the Poole Link Development Officer, said, "We are delighted that NHS Bournemouth and Poole have taken action as a direct result of our findings. Thousands of Hamworthy residents will now benefit from having an NHS dentist on their doorstep." If you live in Hamworthy and would like to put your name down on the waiting list for NHS treatment, you can register on the PCT website from the 1st of July, that's www.dorset.nhs.uk, or send a letter with your name and address to the PCT at Canford House, 551 to 553 Wallisdown Road, Poole, BH12 5AG, for the attention of PALS, capital P, capital A, capital L, lowercase s. Young people speak out. Adults often think they know what young people are thinking, what's important to them and what isn't. But what if young people actually told us themselves? Poole Link decided to find out and gave help and support to young people to actually create their own survey for their own peers to complete, a survey designed by young people for young people. Links worked with local schools and the college to get a good cross-section of young people to tell us what they think of health and social care services. 600 people completed the survey, and the results were intriguing. Exams, body image, drugs, peer pressures, parental expectations, society's expectations in general. It turned out that these are the things young people are concerned about. The results of the survey clearly showed that life's big issues inflict a significant degree of stress and anxiety. We're working on our report now, highlighting the results of the young people survey. Poole Link will be teaming up with Rethink Mental Health Charity to offer stress awareness courses in schools a big win for the young people of the region. We need you, the importance of volunteers in our work. Links here in Dorset have always relied heavily on volunteers. They are the very lifeblood of what we do and are invaluable to the service we offer the community here in Dorset. People volunteer for us for an endless variety of reasons. Many people want to gain experience, acquire new skills, meet new people, or expand their network of contacts as a way to get a new job or start a career. Others just want to give back to their community, to help a friend or promote a worthwhile activity. They do it because it makes them feel good. We feel that volunteering is rich and diverse and can often open up a whole new world to someone. But we're always looking for more people to volunteer with us. We are currently looking for volunteers to visit health and social care services and write reports on the findings. This role involves comprehensive training and support. If you're interested in working with the Links here in Dorset and you want to be involved in a whole host of projects, please contact us today. Call us on 0300 111 0102. Email us on contact@makesachange, all one word, .org.uk, or visit the website on www.makesachange.org.uk. And remember, volunteering is helping, not hiring, giving, not taking, contributing, not counting. Dorset Links utilising social media platforms. There is no denying that the use of social media is one of the most fundamental ways that people now communicate in the 21st century. With the phenomenal impact of social media platforms such as Facebook, Twitter, YouTube, LinkedIn, Pinterest, StumbleUpon, Dig, the list goes on, we can no longer ignore the impact of these communication channels. And here at Links, we're not ones to shy away from embracing modern technology. Therefore, we are now fully utilising Facebook and Twitter to spread the message of the work we do. So if you use social media in your day-to-day life, please do come and say hello via our official Facebook page and follow us on Twitter. We'll be regularly sharing updates, photos, projects we're working on, development plans, project outcomes. For everything you need to know about Links, we'll be posting it online. We look forward to communicating with you out there in social media land. Don't forget to follow now. Bournemouth Link, Sound Solution. Each year, Bournemouth Pool and Dorset Links operate a Have a Say fund, making grants to help local community groups and networks. In return, those groups and networks help us here at Links to understand what the people they work with think about their local health and social care services, and how they think services could be changed for the better. One of the successful applicant groups in Bournemouth this year was Sound Solution. This local charity is focused on working with groups of all ages within the community to provide an environment where people can learn and explore their musical talents and develop new skills. They provide instrument workshops in a safe, friendly environment and nurture a culture of structure and belonging. Using funding and support from Link Bournemouth, Sound Solution was able to purchase a new digital piano and music stands, and had their venue and admin costs covered too. By channeling this creative talent into music, the community is helped hugely by way of crime reduction. Instead of misguided chemical misuse, petty crime and vandalism, those helped by Sound Solution have a more creative and enjoyable outlet through song. Sound Solution expect the number of participants to increase significantly during the summer, leading to further enhanced profile by performing at outside events, yet again feeding back into the community. Learning Disability Centres closure. Following the closure of 3 learning disability centres in 2010, Paul Link took the decision to talk to people who may lose this service to establish exactly what was wanted and needed. Then we put together an extensive report and submitted it to Bournemouth Council. Bournemouth Link teamed up with Bournemouth People First, an advocacy group run for and by people with learning disabilities, and undertook in-depth consultations with those affected, and then relayed the results to the Council, along with recommendations for action. Chris Wakefield, Bournemouth Link Development Officer, said, "It was great to be in a position to help." The extensive report was produced by Links following the survey, and pleasingly, all of the recommendations from that Links survey have been adopted by the Council. The Council delayed the closure of the centres for over a year. Whilst the project was not intended to stop the closure of these centres, what it has done is create a framework for each of the affected users to receive the help and support that they require going forward. A further piece of work was undertaken by the Council's Health Overview and Scrutiny Committee, as recommended by the Links, to ensure that people are given the opportunity to have their voices heard prior to any major change in service provisions. Getting our teeth into discrimination. Discrimination of any kind should not be tolerated. So when we received a number of comments about dentists in the region discriminating against patients who are HIV positive, we knew that something was wrong. The Link worked with Body Positive Dorset, a local group supporting people living with and affected by HIV in Dorset, to find out more. It is estimated that there are around 400 people who are HIV positive living in the Bournemouth area. A questionnaire was made available to all Body Positive Dorset's service users, asking for confidential feedback on local dentistry provision. Our findings suggested that a number of dentists were directly discriminating against people who are HIV positive by giving them less choice of appointment time, and in some cases not taking on new patients because of their HIV status. Following the Links report, a Dorset county-wide communication was sent out to all dentists, ensuring that they understood their required level of duty and care. Liz Kite from NHS Bournemouth and Poole said, "I'd like to assure Bournemouth Links and Body Positive that we take these issues seriously and are keen to ensure that we eliminate discrimination in all its forms." Chris Wakefield, Bournemouth Link Development Officer, explains, "We are very pleased that people living with HIV have been supported to raise their concerns, and as a result of their voice being heard, have directly improved local dentistry services." Dorset Link Eating Disorder Judgemental Workshop. Earlier this year, Dorset Link enabled a workshop to take place that has subsequently changed the way that mental health professionals in the region think about eating disorders and mental health. Dorset Link was approached by Annabelle Davis, who had developed the idea of running a workshop aimed solely at mental health professionals from her own personal experience. For many years, Annabelle has suffered from mental health issues which had resulted in an eating disorder. Annabelle wanted to develop something from her own perspective in order to show the professionals what it was like for her and the reality of living with mental illness every day. Annabelle said, "Dorset Link, especially Annie Dimmock, one of the Link's development officers, provided me with a platform on which to deliver the workshop that I had designed myself. It was a completely interactive workshop with a variety of activities. It was based around the reality of living with a mental illness every day, feelings of hopelessness, and dealing with labels and judgments. Annabelle said, "I'm really trying to make a difference in relation to eating disorders and mental health, and this provided me with the confidence to do it and a platform from which I can help to make that difference. It was the biggest boost I could have possibly had. The help provided by Dorset Link has been invaluable to me, and knowing that the professionals who attended can now see their work from a different perspective is fantastic. I can't wait to deliver more workshops like this. Thank you, Dorset Link. I couldn't have done it without you." Improving nutritional care for older people. Every person receiving care in hospitals or care home settings across our region should receive the appropriate nutrition to aid recovery from illness or to remain well. People who may require support and help to eat should receive that support from nursing and care staff who are trained appropriately and who ensure that the patient experience of mealtimes in those settings is a good one and one that maintains people's dignity and well-being. However, during a 2010 review of dementia services in Dorset, it became evident to the Link that awareness of the importance of nutrition for people with dementia, and for older people in general, was often quite poor in health and social care staff, patients, carers and relatives. Dorset Link had also received feedback from people concerned about malnutrition of relatives in care homes and hospital settings, as well as those concerned for vulnerable people in the community who may be able to access health and social care services and who often fall through the gap due to isolation and other factors. A team of 16 volunteers from the Link completed this project through a process of inspection and interviews and discovered that of the 100 carers, patients and relatives interviewed for the project, 70% were unaware of nutritional importance. A resulting report was written by us about what the experience was like for hospital patients and care home residents at mealtimes. Dorset Link will now be following up the recommendations highlighted in the report, and a copy will also be sent to the Care Quality Commission. It is hoped that the conclusions and recommendations arising from the Dorset Link review will be incorporated into work currently being undertaken both within the local NHS and local council regarding nutrition and nutritional support. Dorset Youth Association Sexual Health Report. Dorset Youth Association, DYA, applied for a grant funding from Dorset Link to help fund the development of a sexual health survey for young people. Dorset Link saw enormous potential for such a project. Gemma James, who led the project on behalf of DYA, says, "From our work in the Roots Information Centre in Dorchester, we found that young people in the more rural areas of Dorset faced a lack of services and inconsistency within sexual health provisions. In lots of cases, they don't have access to relevant sexual health information, and there is a distinct lack of information if you're not in the vicinity of a town or city in the county." Gemma went on to say, "When we received the funding from Dorset Link, we were able to commission a group of young people in Dorchester to develop a questionnaire entitled Sexual Health Makeover. We received 427 results from 12 to 24-year-olds from youth clubs, schools, learning centres, advice and information centres, amongst many other places. We had such a great response. It was the highest number of responses to any other youth-led service in Dorset. The money provided by Dorset Links was spent on development of SurveyMonkey, an online facility for composing questionnaires, photocopying of questionnaires, postage and expenses. Once the research had been collated, there were some fundamental areas that were highlighted, including: young people need to be able to access advice as soon as possible, not go on a waiting list. More drop-in centres are required. More services needed in rural areas. Half the young people had no idea as to what sexual health services were in their area. 40% didn't know where their nearest sexual health clinic was. Schools need to be more open about sex and issues surrounding it. It would appear that teachers are not provided with specialist training or preparation about the subject. More in education is needed around STIs and STDs, especially the symptoms. The extensive report that was produced was then distributed to all the sexual health service provisions across Dorset, where recommendations to improve the services were put forward to include improved sex education in schools. All schools need to be working to the same set of standards so all children receive the same good quality education in sexual health. Up-to-date promotional materials aimed at young people so they know exactly what services are available for them, when they are open and what they offer. More services on offer specifically for young people in places where they currently go to avoid any stigma or the feeling of being judged at times that are suitable for them. Further research to identify the potential cost savings and other benefits which could be achieved by working in partnership with specialist providers of youth services. Gemma summarises the project and help provided by Dorset Links by saying, "It's been such a great project to be involved with, and it's so nice to see service providers taking notice of what the young people have said. The results have really provided the young people of Dorset a voice, and we couldn't have done it without the help, encouragement and funding from Links." Care in focus. Often it is the case that to find out the crux of an issue you need to speak to a wide array of people affected. So when Links across Dorset, Poole and Bournemouth was commissioned by NHS Bournemouth and Poole and NHS Dorset, the PCT cluster, to find out more about the care of those with dementia, we facilitated 5 focus groups across the county to gather feedback from carers of older people with dementia. Focus groups were run across Christchurch, East Dorset, Purbeck, Poole and Bournemouth, with at least 60 carers taking part in these sessions run by our fantastic team of volunteers. Following the focus groups, we produced a report detailing the work undertaken, including a detailed methodology, feedback gathered, and analysis of that feedback. Our report suggests that the main issues for carers of people with dementia include the lack of respite care, the need for better information about the disease, including what to expect as it progresses, the need for more support and training for carers as well as for professionals, the need for carers to be involved in all aspects of care planning for their cared for person, and the need for better diagnosis and support from GPs. We're delighted that our report will assist the PCT cluster by being incorporated into their major review of older people's mental health services in East Dorset and the engagement with carers of people with dementia. Giving clear communications and oriental flavour. One area that all links are focused on is supporting communities that are seldom heard. It is vital to build strong communal ties with the diverse array of cultural communities across our region. With this in mind, the link worked with the Oriental Culture Educational Society, OCES, last year to engage with the Dorset-wide Chinese community. Although there are no precise figures, we estimate that up to 50% of the local Chinese community speak no English or speak it poorly enough to act as a barrier in their access to services. Lucy Tran from the Chinese National Healthy Living Centre helped us to design a questionnaire of 14 questions and arrange for a simplified Chinese language version to be available in tandem with an English language version. As a result of our project, OCES have produced, with funding from Link and the local NHS, some excellent health information packs for the Chinese community. The packs have been welcomed by the local NHS and will be distributed to every GP surgery in Dorset. This material has also been distributed across Dorset Chinese community groups such as the Poole Chinese Christian Fellowship, the Bournemouth Chinese School, and through key Chinese supermarkets across the region. The information is readily available through OCES Chinese Officers Networks, the Bournemouth University Chinese Student and Scholars Association, and via the Dorset Race Equality Council. Alan Merkel-Sanker from OCES says, "It has been a very real privilege to work with Sarah, Link Development Officer, on the Dorset Chinese Community Outreach Links project, and I am looking forward greatly to collaborating with her on the second phase of this important groundbreaking initiative. In working with Sarah from the outset, I was aware of her passionate commitment to the values of multicultural engagement, and over the past year have witnessed through the progression of the project her great initiative and dedicated hard work, especially in engaging extensively with the Chinese community to learn in depth about their greatly varied healthcare needs and issues. In the spirit of cross-cultural awareness, this project has proven so popular that it is being considered by other communities around Dorset. Every person in Dorset is entitled to better understand their healthcare, and a project like this, supported by Link, makes that happen." What we do. The job of Links is to listen to the public and pass on what they find to the NHS and social service departments. What do people say about Links? NHS Dorset and NHS Bournemouth and Poole. We have welcomed the work that Links have undertaken over the past year and their ongoing commitment to engaging with local residents on health issues. We have found their input as an impartial ambassador for better public engagement helpful in our work to develop and change local health services. They have always been extremely professional, and I believe that we have a healthy, honest and supportive relationship working toward the same goal of achieving better outcomes for our local residents. Liz Kite, Deputy Director of Corporate Affairs. Bournemouth Borough Council. Bournemouth Borough Council gives high priority to listening to the views and aspirations of local residents, and this is particularly important where health and well-being issues are concerned. The Links service has provided an independent and impartial platform enabling local people to have their voices heard on a range of issues important to them. Valuable feedback and robust data has contributed substantially to the ongoing evaluation and ongoing improvement of services as we have worked together in partnership toward making Bournemouth a better and healthier place to live and work. Councillor Blair Crawford, Cabinet Portfolio Holder for Adult Social Care. I was pleased to join Link Reading Group as a volunteer. It is interesting work valued by the authors and likely to help the intended recipients get the message. I enjoy it. Why don't you join us? You would be very welcome. Gerald Rigler. Thank you. It was great to share information and be given a cash incentive. It's great to feel valued. Links Focus Group Carer. The session was very helpful in hearing the problems we all share and feeling our views will have a hearing ear. A Links Focus Group Carer. My thanks to Link on behalf of the Trust for this important contribution to improving discharge services from Poole Hospital for the benefit of patients and their families' carers. Martin Smits, Director of Nursing at Poole Hospital. Facts and figures about Links. Steering groups. Each of the Links in Dorset has a steering group to oversee its work. All members are volunteers and their work and commitment is greatly valued. They are Gavin Maxwell, Gabrielle Henstridge, Eileen Mitchell, Lindley Venters, Paul Tomlinson, John Smith, Dorset Link, Barbara Plumbridge, Bob Kensley and Mary Lee, Paul Link, Pat Lewis, Jane Kelly, Michael Hodges, Greg Cox, Phil Carey, Tina Thompson and Barbara O'Brien, Bournemouth link. Enter and view. By law, links have the power to enter premises where publicly funded health and social care services are delivered and view the services being delivered there. To do this, the links have recruited and trained volunteers to become members of their visiting teams. The members of the visiting teams of the links in Dorset are Noella Green, Eileen Mitchell, Gabrielle Henstridge, Zoe Mensing, Mary Barnes, Rose Bryant, John Bryant, Christine Pryor, Hilary Foggo, Margaret Long, Pat Lewis, Catherine Garcia, Judy Birch, Bob Kensley, Michelle Keenan, Mary Lee, John Hyde, and Anne Bowler. For the Soundbites project, the following premises were visited. 1 visit per premise was made. The Soundbites project was triggered because of previous work the links had done on dementia, and the findings from that work highlighted that malnutrition in older people in care settings is an increasing problem. The Soundbites project was instigated to look at how malnutrition is assessed in health and care settings, whether the patient service user experience of mealtimes in those settings is a good one, whether people are supported to eat with dignity and respect, and whether information about malnutrition, good nutrition, is readily available to people, including carers, patients and families. The results of these visits have been documented in a report. In addition, as part of other link projects, a visit was carried out to Poole Library, and as a result the library is now a safe zone, and the library's facilities are being promoted to learner disability groups. A visit was also made to Strictly Vitality Day opportunity in Poole, and good practice seen there has been shared and promoted by the link. Reports and recommendations. The links submitted a number of reports with recommendations during the year, including a report on the experience of people living with HIV/AIDS accessing NHS dentistry services, a report on the experiences of people receiving personal budgets, a report into young people's experience of health and social care services, just another day spent on my own, a report on the impact of changes to social care services in Poole, Poole Central Library report, an enter and view visit report, visit to Strictly Vitality report, an enter and view visit report, leaving hospital report, hospital discharge survey, report on the findings of focus groups for carers of older people with dementia, soundbite report, report of findings from enter and view work looking at the patient service user experiences of mealtimes in health and social care settings, a report on research into health information for Chinese people living in Dorset. Projects incorporating Dorset County Hospital Elder Care Wards, St Leonard's Community Hospital, Westminster Memorial Hospital, Victoria Hospital, Blandford Community Hospital, Swanage Community Hospital, Bridport Community Hospital, Westhaven Hospital, Yateman Community Hospital, Portland Community Hospital, Wareham Community Hospital, Weymouth Community Hospital, Hayes Care Home, Anglebury Court Care Home, Castleman House Care Home, Avon View Care Home, Lawns Care Home, Streets Meadow Care Home, Sydney Gale Care Home, Mellstock House, Treetops Care Home, Chaseborough House Care Home, Castle Farm Care Home, Broad Windsor House Care Home, Bosworth House Care Home, Avondene Care Home, Avon Reach Care Home, Clifftop Care Home, Newton House Care Home, Highcliffe Nursing Home, Easterbury House Care Home, Culliford House Care Home. Requests for information. Links have the legal power to request and receive information from commissioners and providers of local health and social care services. This is a power which the links in Dorset rarely use. It has proved possible in most cases to get the information the links needs by more informal means. However, some formal requests for information were made as follows. For information on carers' breaks was sent to NHS Bournemouth and Poole in August 2011. For information on continuing health care was sent to NHS Dorset in February 2012. A response was not received within 20 working days. For information with regards to the response to the closure of day centres in Bournemouth. For information from the Royal Bournemouth Hospital with regards to their PALS inquiries and complaints. For information on epilepsy service provision in Dorset. A question to ask if a person is admitted to hospital. After how many days would that person's care package be cancelled? What process would they have to go through to get another care package in place for when they left hospital? Unless otherwise noted, all requests for information were met within the statutory period of 20 days. Referrals. The Bournemouth Link made one referral to Bournemouth Council's Health Overview and Scrutiny Panel. The link asked for a task and finish group to be set up to examine the process around the closure of Dorset, Horizons and Malvern day centres. The Overview and Scrutiny Panel set up a task and finish group to deal with the concern raised. Money matters. Each link is funded by the local council, using money allocated to it by the Department of Health. In 2011-12, the funds the links in Dorset received from the local councils were £82,700 from Poole, £167,700 from Dorset, and £78,500 from Bournemouth. In addition, we carried forward some savings we had made in the previous year. On staffing, which includes link development and communications officers, together with administration, telephone helpline, finance and management staff, office and running costs, the Poole link spent £71,694, the Dorset link £119,027, and the Bournemouth link £77,801. On link projects, including reviews of services, questionnaires and surveys, engagement, organising events and meeting groups and individuals to get their experiences of and views on their local health and social care services, marketing and communication, including e-bulletins, newsletter, advertising, website, etc., the community chest, grants to local community groups, meetings costs and reimbursement of the out-of-pocket expenses of link participants. The Poole link spent £22,055, the Dorset link £24,672, and the Bournemouth link £15,458. During the year we made savings on our original spending plans so as to build up funds which could be carried forward into next year and used to help fund extra work related to the transition from links to Health Watch. Getting involved in links. You don't have to join or become a member of links to be involved. Anyone living in Dorset, Poole or Bournemouth can get involved in ways that suit them. You could choose just to be kept in touch. We keep a database of people who've expressed an interest in links, currently 2,846 of them, and keeping them in touch with what the links are doing through regular bulletins and newsletters. Or you could express an interest in being part of the links visiting teams which visit premises where services are delivered and report on what they find, or you could volunteer to be part of one of the groups that are regularly set up to look into how particular services are designed or delivered. Contact us by telephone on 0300 111 0102, email via contact@makesachange.org.uk. The website is www.makesachange.org.uk, or by post. The address is Free Postal Licence number BH1902, Links, 896 Christchurch Road, Bournemouth, BH7